Hi everyone, this is a short introduction video just about jaundice in neonates. It's going to show you how to actually use Encompass to figure out if a patient is jaundice, and using the graph that appears on Encompass make it a bit more easier for you to be able to follow. So I'll just move on to the presentation here. Start off, I really highly recommend that you read the NICE guidelines regarding jaundice in newborn babies under 28 days. Just because I'll be talking about several of the guidelines in this presentation anyway, but it's not a play-by-play of everything that appears in the guidelines, and I think it'd be just worth a good read, just so you understand it a bit better. But important things to sort of, before you even start really getting in to C2, you would need, whenever you're actually logging into Encompass, you need to set your job as just doctor in training, but your clinical setting as SCUBU, so just the SCUBU. The reason for that is because it on Encompass, it will prevent you from using like specific services that are on Encompass unless you're in the subs or in the subspecialty of SCUBU. So just make sure that you're able to do that. Otherwise, you'll not be able to see like the bilirubin tab or be able to discharge patients properly. So it's just really important about that. The other thing is that if you have any concerns really with jaundice, or you're not really understanding or worried about something in particular, always ask a senior. Everyone's very approachable in pediatrics, so don't be suffering in silence. Ask anybody around you. Just to quickly go over some of the NICE guidelines, and just some of the more important parts, but I still recommend that you read the full article. But essentially, the reasons you would want to be doing a serum bilirubin test over just using the bilimeter. So you'd be doing the blood test if it's a baby that's suspected of having jaundice in the first 24 hours of life. Obviously, that comes with a lot more other concerns. You want to be making sure that the baby's not Coombs positive and having hemolysis because of that. And similarly, you would be high index of suspicion for sepsis, and then following the sepsis pathway. Other than that, then the only other reason you would want to do serum bilirubin over doing a bilimeter is if they were less than the age of 35 weeks. But you'll generally find that most of those patients will be in neonatal anyway. But just to be aware of that. If a baby is over the age of 35 or gestation of 35 weeks and they're over 24 hours old, you can use the bilimeter, which is a device that, if you're not familiar with, if you ask one of the midwives just to show you how to use it whenever you're on C2, it sort of defeats the need to do any unnecessary bloods essentially. But I'll show you where you would find that on Encompass anyway. Another part of the guidelines then about before starting phototherapy. So in babies who are clinically well and have a gestational age of 38 weeks or more and are more than 24 hours old, and have a bilirubin level that is below 50 micromole per litre from the threshold for doing phototherapy, depending on potential risk factors, is sort of dictates whenever you're going to be repeating serum bilirubin. So if it's a baby that meets the sort of risk factors of having a other sibling that's had neonatal jaundice and needed phototherapy, or a mum is exclusively breastfeeding, you would want to repeat the bilirubin within the next 18 hours, just to make sure that the bilirubin levels aren't increasing. Similarly, if they have none of those risk factors, you probably still want to repeat it within 24 hours, again, just to make sure that the bilirubin levels aren't increasing. In babies that are clinically well over the gestation age of 38 weeks and are more than 24 hours old, and they're more than 50 micromole per litre underneath the phototherapy threshold, you don't routinely need to do a billimeter measurement then. So if you have a baby that you're querying that is jaundice and you use the billimeter, so you're not doing the blood test, you're using the billimeter, and it comes back as say 100, but the threshold is 150, then you wouldn't need to do any further blood tests, and you wouldn't routinely need to repeat a bilirubin measurement unless there was some other new concerns or new clinical need. And then obviously if they don't need any phototherapy, if it doesn't exceed the phototherapy threshold, and that's purely from doing the serum bilirubin and not the billimeter. Okay. During phototherapy, then you want to initially do another serum bilirubin within 6 hours of starting phototherapy. That's just to make sure that the phototherapy is actually working. and that the bilirubin levels aren't increasing rapidly, in which case you would maybe need to change your management, and whether that needs double phototherapy, or if it's increasing too rapidly, you might want to get senior input and potentially require exchange transfusion. Other than that, then you would just be repeating the bilirubin levels every 6 to 12 hours while they're on phototherapy. So essentially, babies would be started on phototherapy. You repeat the bloods 6 hours in, see if there's any sort of change, or if we're getting any improvement, and then you repeat it every 12 hours from then, making sure that they're coming down nicely and going below the treatment threshold. Once you get to below 50 micromole per liter underneath the phototherapy threshold is whenever you can probably consider stopping phototherapy. But then you would need to recheck the bilirubin again about 12 to 18 hours after stopping phototherapy to make sure that it's not rebounding back up again. Generally, patients don't need to be in hospital for that, so unless there's a clinical need, they can be discharged home and it can be done in the community, or you can bring the patients back in just through the Acorn Centre or blood clinic, whatever is appropriate at the time. Using phototherapy then, so it's similar to, it looks like sunbeds essentially for the baby. But the reason you would be using double phototherapy or things like that is if you're repeating the serum bilirubin levels and you notice that it's rapidly rising from more than 8.5 micromoles per liter every hour. So if you had a baby and you done their original serum levels and you repeated it again in 2 hours time, and if it was more than 17, you would be thinking that it's more than 8.5 micromoles per liter per hour then. Another thing is that if the serum bilirubin level was within 50 of exchange transfusion, then again you would want to maybe consider doing double phototherapy than just single phototherapy. The other thing to mention then is the bilirubin level fails to respond to initial phototherapy. That's another reason why you might want to consider double phototherapy. Yep, I'm going to make sure that's everything on that. And of course, if the serum bilirubin level isn't responding to double phototherapy, then you're probably going to consider doing exchange transfusion. But again, that would be requiring senior input and probably an admission to NICU for that. Okay. This is just the Encompass slide, or the page that you would necessarily sort of find the bilirubin then. So hopefully you'll be able to see my mouse. So whenever you first log in, you might not necessarily have this tab, the Find the tab. If you go to this arrow and click on it, I'll give you a drop down menu and there should be a slide for bilirubin. If you click on that and even drag it up to here, it should stay on your page then every time you log into Encompass, and saves you having to press this arrow every time. Midwives will then complete billimeter checks if they think it's appropriate and log whatever levels that they get on Encompass itself, and it should chart onto this graph. Similarly, if you're doing serum bilirubin levels on a baby, once the bilirubin levels come back through labs, it should automatically just log or chart the level onto the graph. So you can see from this example here, the billimeter readings were at this point. You can see that it's reaching phototherapy threshold, which has probably prompted the team to complete serum bilirubin levels, which then came back as just on the line for phototherapy. So this would usually prompt you to complete phototherapy. So after 4 to 6 hours, then you would want to repeat that, which might be this one here, which you can see is still increasing. But then after another further 6 to 12 hours, it was repeated again. You can see that it's decreasing there. And from this point, you can make out that it's probably at about 290 here and about 240 here. So at this point, you could probably consider stopping phototherapy and then rechecking the bilirubin levels in 12 to 18 hours time. So that's a very, very quick introduction to jaundice in neonates. It's not a play-by-play of everything, and obviously if there's any concerns or worries, just contact the senior. We haven't really talked much about the potential for sepsis with jaundice, especially in the first 24 hours of life, but there should be a video within the documents there just to see about starting the sepsis pathway in neonates. Hopefully you get a wee bit more information about that. Again, similarly, I still really recommend that you read the UK NICE guidelines regarding jaundice and neonates because it's really, really helpful about how to discuss it with families and what needs to happen for the baby while they're receiving phototherapy. So hopefully that is a wee bit of an introduction, a bit helpful. Thank you very much.